think, like many people, I wanted to become a doctor to help people. And medicine is this unique opportunity to do something that's really at the cutting edge of science. Not only do you get to interface with people in terms of, the most intimate and vulnerable parts of their life, but also you get to use exciting technologies, medicines, and in our case, surgeries to help them. My name is Tiffany Hwa, and I'm a head and neck surgeon at Penn Medicine. I'm an otologist, neurotologist, which means that I specialize in the disorders of hearing, balance, and tumors of the skull base. And what's interesting is that hearing loss disorders really affect the whole lifespan. And you get a huge span of disease from benign to certainly cancers and malignancies. And so I really enjoy having this kind of wide breadth of practice. I work with a number of different colleagues, our specialists in audiology for anything non-medical, like hearing aids, for example, all the way up to surgical interventions like cochlear implants. I work very commonly with our neurosurgical colleagues on tumors, as well as our head and neck surgery colleagues with cancers around the ear. Sometimes people have problems with their ear bones, a condition called otosclerosis, or sometimes after trauma, they'll have hearing loss that due to disruption of the blood supply to the ear bones. We actually have these amazing technologies nowadays to kind of do surgery under a microscope or using an endoscope to put in metal prosthesis and reconnect that hearing ability. I would say our acoustic neuroma program is incredible. We have a really collaborative relationship here for really not just acoustic neuromas, but all lateral skull-base disorders. If you have a defect that is causing some of the fluid from your brain to leak into your ear, and certainly various tumors of this area, this is a difficult area of the body to access. It's a difficult area of the body to kind of interpret sometimes on imaging. We work very closely with our neuroradiologists, our neurosurgical team, our neurologists, and certainly within our division to make sure that patients are getting top-of-the-line care that's tailored to their concerns in their specific case. I am somebody who definitely listens to my patients. I'm fluent in English, Español, and Zhong Wén. Being able to speak with my patients naturally in their native language really helps me to connect with them and ultimately provide the best possible care. I think that a good solution has to be a solution that's matched for you. It's gotta be the right thing for you and the considerations that are unique to you. Thankfully, we live in a time in medicine where there's so many different options, and it's really not a one-size-fits-all. I'm somebody who does not like to leave stones unturned. I'm going to examine the part, everything in the head and neck, even if it wasn't what brought you here. And I really want to think outside the box and help you find a solution.